Hello, today I'd like to talk about menopause and what it is. So menopause happens to women and it's often referred to as the change in life. What happens during this change is estrogen and progesterone normally produced by the ovary starts going down. It typically happens median age at 50. It can happen sooner. There can be early menopause, perimenopause, surgical menopause if they have surgery to remove the ovaries. So what happens with that? So when the estrogen and progesterone go down, a woman can get all sorts of symptoms such as hot flashes, mood swings, lethargy, weight gain, just don't feel well, just chronically fatigued. Sometimes it's not very severe, and in some ladies it can be very devastational. They're always hot, they're always sweaty. It really interferes with the quality of life. So for many years we use hormone replacement with estrogen and progesterone, brand name Premarin and PremPro. We stopped using it about 15 years ago because there were some studies that suggest that it might be a higher risk of either breast cancer or heart disease. So as of lately, these studies have been redone and it appears to be very safe. So if a woman has a lot of symptoms, the good news is now we can use hormone replacement again if they're not at high risk for these other conditions. There's other medications, sometimes antidepressants like Zoloft can help with the vasomotor symptoms, and newer prescriptions that have just come out, they tend to be not generic and expensive, but in the right person with a lot of symptoms, it can restore everything. And it can even add to their less mood swings, less hot flashes, less vaginal dryness, better intimacy, all around a great improvement. So if that's something a woman or you are interested in, please discuss this with your primary care or OB-GYN. I hope you found that informative. If you do, feel free to share with family and friends. Follow me on social media, on YouTube or other platforms, or my website, drgregmd.com. Thank you.